A warm welcome to all our viewers to our series, Natural Medicine. Today we're talking about migraines. And are migraines just something in our heads, or are there actually bigger connections to consider when treating migraines? Or is a painkiller enough? I'd like to discuss this today with a doctor from the Sonnenberg Clinic, where she, together with Professor Dr. Thomas Rau, is working, namely Alexandra Kotthaus, who's here today. And we'll start right away with the topic. So, dear Alexandra, welcome to the studio.
Thank you, dear Alexander.
Migraines, is that something that affects a lot of people these days?
Yes, it is indeed something that affects a lot of people with us, and I don't want to say it happens incredibly often, but it happens. Sometimes it takes a while for the patients to find their way to us if they don't have other symptoms with it.
I don't know. I think I used to have migraines again and again. It started with my eyes, everything just flickered. And then I always had to stay in a dark room for 2 or 3 hours, and at some point it was fine again, but I couldn't see anything. Then I was sent to the doctor, who then did blood circulation tests. And then as a young person I got some pills, blood thinners.
Wow, that's not quite typical, but it does happen from time to time. Some people just think migraine with aura. So aura is the flickering in front of the eyes. There may also be other symptoms apart from the headache. Some have nausea, sensitivity to light, noise sensitivity, that one assumes it is attributed to narrowing of the vessels in the head. And in very, very rare cases, serious circulatory disorders can occur, but that's the exception rather than the rule.
I only took it when I noticed. Now the flickering comes back. Today I think I certainly screwed up, because that was never a cause treatment. Rather, it was only at the effect level. I understand that that's why we have to do this show and make people aware that migraines also have a cause. And where is the cause? How does a migraine sufferer or afflicted person treat the cause of the migraine so that it no longer comes? I know what I'm talking about.
I can't say anything from my own experience. So headaches, migraines is something I've been pretty spared in my life. I have, however, worked in neurology about 9 to 10 years ago, so in the hospital. And we sometimes also had patients who really had a migraine attack lasting several days, who received infusions and were hardly treatable. So it really is almost unbearable pain. At that time, when I was working in the department, we also did internal training there. And it was my turn, and I had the task of summarising the guidelines in migraine therapy for colleagues. That was somehow, let's say, unsatisfactory, because somehow it also became clear what is actually the cause. It is not at all clear what is really the cause, and then there are so many therapy approaches, but usually they hardly work. There are also guidelines in therapy that are recommended where they say, yes, acupuncture is effective for migraines, even if you don't do it the classic way. What then often leads to academic medical colleagues saying it's a placebo effect anyway. And then there are all kinds of medicines. Beta blockers, antidepressants, then there is the group of triptans. These are drugs that widen the blood vessels, where I indeed have patients who can successfully treat their migraine attack with it. But on the other hand, it's also clear that a drug that manipulates the vessels also does it to other organs. So there I can also possibly damage the heart. So if you have problems in other areas, they are not without risk. Luckily, I did not experience such serious side effects. Another problem is that they are usually meant to be used when the migraine attack starts, so it doesn't get any worse. And some patients then say, yes, that helped. Then after an hour or two, the attack came again. Then I took another one, and then I took another one. And you shouldn't actually do that with these remedies, so that you don't increase the side effect rate. In any case, based on this experience that I had in neurology back then, and also that I had to do the guidelines, I thought, it's a disease that's really not easy to treat and pretty mean. On the one hand, not dangerous or life-threatening from a medical point of view, but it's really nasty to have this pain. And if you are confronted with it several times a month, it's not a good quality of life. I would not say that migraines are one of those things that are easy to treat. Based on the current experience where I consistently do biological medicine, and I just see attacks reduced relatively early in treatment. Sometimes there is another migraine attack which is nasty, but the intensity of the attacks and the frequency are usually very quickly reduced. What do we do at the beginning? First of all, this is the change in diet.
Wheat.
Yes, exactly. Wheat is one topic. It's a plant-based diet. It's not just about leaving out potentially harmful things, eliminating things that promote inflammation, but also reintroducing more good things into the diet. My favourite building block in the diet is chlorophyll. So greens. And I say you can never eat enough greens. I also like to say that elephants and cows only live on greens.
The gorilla.
Yes, of course there are more animals. Of course they have very large bodies, so they have to eat a lot of it. They also have a slightly different digestive system and can eat other things, but from the possibilities that are in greens, you can build very large bodies with strong bones out of it. Chlorophyll is a very important component of greens, and the chlorophyll is especially effective when it's not heated. Or you can heat it up for a short time, but it mustn't change colour. Once it changes colour, it loses its function. What many people don't know is that chlorophyll is the same molecule as our hemoglobin, which is the red blood pigment. It's also the same molecule as our cytochrome. I have the cytochrome on the one hand in the liver as part of our detoxification system, but I also have it in the so-called mitochondria, in our small energy power plants, in our cells. So there ATP is produced, and 3 molecules on this path of energy production. In the so-called respiratory chain where the oxygen is utilised are basically hemoglobin or chlorophyll molecules. There are also indications that we can really use this chlorophyll, which we absorb through the intestines.
That means we could produce more ATP.
Exactly.
Of course, that's the be-all and end-all for every healing process.
Exactly. Now we're getting to a very interesting thing. What I can also really use is sunlight. The infrared spectrum of sunlight causes of cytochromes in the respiratory chain to work better. And I really can, in the combination with chlorophyll and infrared, increase ATP production. Infrared light can also be used for neurological problems, so for things that are in the head. Also better for microcirculation. That means circulation of the smallest vessels and also the brain.
Now that you talk about infrared, may I ask about infrared sauna? Is that possible?
There are different types of infrared within the infrared spectrum. They say A, B, C. The infrared B is rarely mentioned, rather the infrared A. The infrared A is what I just meant with the cytochrome C, so with the improvement of the microcirculation and so on. The infrared C is usually what I have in the sauna. This also has an effect, so our own body also emits infrared C. Every living being emits it. The thermal energy that we radiate is also infrared C, and can therefore also, if I supply it externally, promote many healing processes. You can also detoxify wonderfully with an infrared sauna. And that brings us back to the topic. If I now draw the bow back to migraines, diet is on one side, detoxification is on the other side. My experience is that there are basically three main reasons for migraine attacks. One is histamine. For example, you can take a chamomile tea enema during a migraine attack. It binds histamine in the intestines, transporting the histamine out and thus interrupting or alleviating the migraine attack. According to my observation, the second most common cause are migraine attacks triggered by tension headaches. So back and neck tension, the patient typically says it comes from here. It always travels here, and when it arrives here at the front, then comes the rest, then comes this sensitivity to light. Then I have to retreat into the dark, hear nothing, see nothing. Everyone should leave me alone. Now we had histamine. I said three things.
I'm still thinking about the back. Is the back the cause, or are we actually still on the histamine?
No, that's the second cause, the back.
Oh, so it can come from the back.
Exactly. That it then additionally triggers.
So what do you do then?
Neck tension can also be treated in various ways. Acutely, we like to do neural therapy. Neural therapy is an injection therapy with procaine or lidocaine, so a local anaesthetic, which initially relieves the tension and relieves the pain. There are certain other places around the head that you can just try there too if it's acute now, to alleviate the migraine attack. Or best of all, interrupt it, of course. Depending on where the cause comes from, physiotherapy can be right, osteopathy, craniosacral therapy, there are different possibilities. Of course, it's always good to look on the whole skeletal system. Do I have an atlas blockage up here? What about my jaw? Many people don't know that the muscle that makes the jaw clench is just as strong as the quads, actually stronger than the quads, where you think, hey, these are muscles that get me up the mountain. Then you can feel that there is power in it. But what I do with my jaw, when I clench tightly here, then this can really lead to the first vertebra also shifting at the top. When I clench my teeth at night, I don't really relax and regenerate. I block the lymph drainage to my head. I can then collect more things again, which can then trigger headaches and migraines. That's how we get further and further away from the topic. There's just something in my head. On this whole human system, there is a lot more to it than that.
So basically, when I bite my way through life, the tension also comes, and that can also lead to migraines. It was effective for me. I was a pasta junkie, and when I really reduced that, the issue was settled.
There's a really big connection here, brain and gut. That's out of the question. So like I said in the beginning, most migraine sufferers who are it's really early on in the treatment, within the first few weeks, that the migraine attacks are drastically reduced. So that I would really say that it's not that difficult to treat. And 10 years ago, I still thought, oh, maybe not bad, but nasty.
Could there also be a causality between a dead tooth that still somehow radiates towards the brain?
Also, of course. There are teeth that play a special role because of their position, that perhaps do this more than other teeth, but if I have silent inflammations in the jaw area, then of course I can trigger that further.
I can swallow as many headache pills as I want. It keeps coming back because the cause hasn't been treated.
Exactly. I mean, you can go further there. You can also say scars. What about scars? Sometimes you have to suppress scars. So the first time I heard about neural therapy was from a friend of mine who had a spontaneous pneumothorax. So as a young woman, just said, well, of course, not just like that, but from the point of view of academic medicine, the lungs collapsed. She needed a drainage to pull the air out of the chest again so that the lung could expand. After that, she developed pain that came up here, where she said, nothing helped me, no painkillers, nothing. And her gynecologist then asked and started injecting the scar, which wasn't even at the head. And then the pain was gone. Partially gone for a few months, then she noticed it coming back, had the scar injected again, and had peace again, until it finally brought long-term peace.
I've known about this neural therapy for maybe a year or two now, through treatments my wife has enjoyed. We have the utmost respect for this treatment. We say it's brilliant. In the field of scar suppression, isn't that somehow still a ridiculed topic from academic medicine?
I don't even know if people ridicule it, because I hardly know any academic medic who has heard of it before.
But in general, you don't treat scars at all, do you? There may be an ointment and that's it.
No, not in academic medicine.
The fact that a scar can have an effect is never really researched anywhere.
No, well, I once persuaded a patient with honeyed words to have this neural therapy done at a scar, where she said, I've had the scar for 25 years. It can't be, I haven't had the pain that long. And I said, please, let's. No, I don't want that, I don't want that. Then she finally let me do it, and the pain was gone. Or also in older people, where the wound healing may not be so good. After hip surgery, an elderly lady tells me, I always have pain in my foot since I've had hip surgery here. I always have pain in my foot. We've tried so many things, it just won't go away. Then I treated the hip scar, and the foot got better.
Okay. So that means that every person is well advised, if they have a scar, to have a look at it from a biological doctor, whether they should somehow be suppressed, because the nervous networks are really so sensitive here that they have an effect.
Yes.
Let's get back to our migraine patient before we get to headaches, because there might be differences. So now you said, on the one hand, histamine problems if you omit it. It can get better if it comes from the neck, then massages and relaxation exercises are just there. But don't forget that it can also be from the teeth, biting teeth positions. And then you wanted to say something else, where I kept interrupting you. There was something else.
Exactly. Now I have to think for a moment myself. Hormones. Right.
Hormones can lead to migraines.
There are migraines that are cycle dependent.
The women, they always have a headache.
Exactly. That's something too. So in my perception, what I see most often in my practice are these three triggers. And some have it when menstruation comes. Some have it in the middle of the cycle. But if it's that regular, then it is, of course, relatively obvious that it must have something to do with each other. Most of the time, it's not necessarily your own hormones to blame, but what we call xenoestrogens. Xeno is the Greek word for foreign, so foreign female hormones. Hormones that our body does not produce itself.
From food again.
Part is from the food, so certain pesticides also have the form of xenoestrogens, glyphosate for example. A metal like mercury is also a so-called hormone disruptor, so it messes up our hormone system. But when we also have the xenoestrogen in other things, these are these things: PBA, PCB, phthalates, pyrethroids. These are substances found in plastic packaging of food. Impregnation of functional clothing, coating of frying pans, shoes, water-repellent sports shoes. Those are things we can get that from as well. Plastic bottles for water or even other drinks. If the drinks then also contain acids, even more will be released from the packaging material. into the liquid.
And then the bottle's lying in the sun. That's the worst case scenario, isn't it?
Then you get the extra portion.
If you then drink such water in the sun with carbonic acid, you drink that, then you have a lot of foreign female hormones that you take in. That also applies to men.
That applies to men too.
Ultimately, it also feminizes with other problems.
With other problems, exactly. I'm also seeing more and more breast growth in younger men, so under 30. And the increase in prostate problems also has something to do with it. And since it's becoming more and more common in our environment, we have more and more, and younger women, maybe even with menstrual disorders, who had a very unpleasant beginning menstruation until it levelled off. I used to ask myself, what was it like 300 years ago when a woman started menstruating? How did she deal with that? Because many women find it uncomfortable. When the time starts, many girls don't participate in gym class at school because they feel it's because the bleeding is too heavy. That's something which did not previously exist on this scale. This really is also partly due to our environmental impact.
So let's sum it up again. Let's stay with migraines because we have to deal with the hormone issue separately. Whenever there are headaches or migraines within a recurring periodicity for a lady, then she would have to consider, where do I get these foreign hormones from? How do I take these?
Exactly. Some of it can be avoided, but nowadays it cannot be avoided completely. But you can see that you don't drink water from plastic bottles, that when I buy new clothes, I wash them beforehand, but also the topic of cosmetics, there I have various toxins in it. Roughly speaking, an average woman ingests 150 different toxins per day through cosmetics alone.
That's outrageous.
The sources are varied. That's why I always tell my patients, sometimes it's difficult. You won't always find the reasons or find the sources where it comes from. What you can avoid, you should avoid. But it's more important than ever to get the wrong hormones out on a regular basis, that you detoxify.
Now, you're just saying 150 toxins you ingest daily, and it's all legal and approved. I keep asking myself, where is the responsibility in these times? Who should actually bear this responsibility? Or say this is allowed and that it is not allowed? I just don't get it anymore.
Myself, where my heart bleeds is when I see small children. I've already done such tests on small children for xenoestrogens, and partly the youngest patients where I found enormously high values was 3 years old. With these xenoestrogens, they came from the dentist because of chalk teeth, and then it turned out he lives in the country but surrounded by conventional agriculture. So I think these are things that shouldn't be, that children aren't protected.
Well, let's make another switch between migraines and headaches. It's not nearly the same, is it? Or do you see parallels?
As a number of illnesses that cannot always be clearly differentiated or put in drawers, it merges into one another. In the case of some illnesses, it is also called spectrum disorder now. I think now for the term headaches and migraines, that would not be bad either. From a conventional medical point of view, one tries to differentiate different causes for certain headaches, to then just say this headache is called this and that is called that. From our biological point of view, we don't do these distinctions at all because we want to treat causes. If I treat the cause, then what the headache is now called is actually secondary for me. It should just go.
Maybe a parallel to me again. As I said, I know the subject of migraines. Thank God it hasn't been that regular, maybe every 2 months. Eventually the issue went away with nutritional improvements, but headaches were still there because I still haven't eaten completely well. But only when I introduced exercise for me, movement into my life, headaches were over and gone. There's nothing there anymore, and well, I'm 52 years old now. I've really had headaches for 52 years. My mother has been using tiger ointment since I was a child, and God knows what. None of it helped. The only thing that helped was dufalgan. But I can't take dufalgan for the rest of my life. That's really crazy. Now I just know a little exercise, a good diet, and no more headaches. It's such a blessing. Is that your experience too? Does movement also have a connection? For me it had, but how do you see it?
There are so many different factions. I think movement is important. I think diet is even more important. I usually ask whether my patients do sports, and there is a device that I am happy to recommend, such a swing stick. And this stick can simply support the lymphatic drainage. If someone now says, no, I don't have any time at all, I don't feel like it, I have a bad knee, I can't ride a bike, then I say, hey, I usually have one in my doctor's office. Here, try this.
It does this.
And then the whole body shakes. The antagonizing muscles, so the opponent muscles, they are trained. It trains the deep back muscles wonderfully, and it's good for posture, but I also just have a relaxation here, from here on through the shoulder girdle. I have improved circulation all over, and I have a lymphatic drainage, and that's just something. You have to do it yourself. Of course, sport is important. And we also know that sport also has an effect on the internal organs, so I also keep my kidneys and intestines fitter when I exercise. It doesn't have to be huge. But we have a locomotor system. If I may quote another colleague, whom I think you know personally, who says, we have a locomotor system and not a rest system.
Who was that?
Rudiger Daiker.
Ah, right, yes, exactly, great. So, to summarise, you don't have to live with headaches and migraines. There are very clear symptoms. The body says something is wrong, and just take a pill to end it. Like I've done for decades. It's totally wrong. I know that. I mean, all this poisonous stuff has to get out of my body again. It's horrible what I've done to myself.
I don't want to say, well, if you have an acute attack, it can be so bad. I wouldn't tell any patient now. There are a few tricks we can use, but if they don't help, then I say, take the painkiller. You have to break this vicious circle. What biological medicine does then is prophylaxis for the next attack. The reduction in intensity, and it's also possible to get rid of that.
Good. I really wish that for everyone from the bottom of my heart that they are not confronted with this crap. When you suffer from it or suffer from it again and again, you really heard a wide variety of approaches today, where it comes from. And you should just clarify that carefully and see whether you also fall into this group. And if so, you simply end it and change it. Suppress it or make a change in diet. So it just works. So I wish you, with all my heart, that you find your way out of this valley of pain. Maybe look for biological doctors somewhere who are familiar with it, who simply see these causal relationships better, or have simply learned from empirical medicine that these connections exist. That's it for today. Thank you very much, dear Alexandra Kotthaus.
Thank you, Alexander.
Always exciting to talk to you about nutrition, I think. We'll do a lot more, and also one about hormones. We'll do that later. All the best. See you next time.